There's not a day that goes by that I don't think about dying. I want to burn myself. I don't deserve to be happy. I'm bad. I want to be hurt. I'm disgusting. I prayed that God would take me in my sleep last night. I'm not good enough for anyone. If people really knew me, they would not want to know me. I'm crazy. I feel safest in the hospital. I hate myself. I'm unlovable. Those are just some of the many soul-ripping sentiments of people with BPD, borderline personality disorder. The good news is that help is available. And today we're going to take a look at this fascinating disorder and how to treat it successfully and well. In terms of diagnosis, if you really want to just nerd out, you can find the full technical criteria for BPD as defined in the DSM-5, the Diagnostic Manual for Mental Health Professionals, online by searching BPD criteria DSM-5. But essentially, BPD is a pervasive pattern of instability of interpersonal relationships and self-image. The mood of people with BPD is often very labile, which means very up and down, sometimes within minutes or hours, and often seemingly, but actually never, unprovoked. Moods for BPD people can become hyperbolic or really extreme at times. People with BPD often have difficulty controlling their impulses. Now, that impulsivity may be internalized, such as through self-injury, cutting, burning, or externalized, such as lashing out at others for what seems like no reason, or being reckless in their behavior, such as driving erratically, being sexually promiscuous, using drugs, spending beyond their means, etc. So you may be thinking, wait, isn't that just bipolar disorder? No. BPD is often incorrectly diagnosed as bipolar disorder. The difference is that people with bipolar disorder will have moods that vary across days or weeks versus minutes or hours. Bipolar mood changes also are chemically triggered. So people with bipolar disorder may literally go to bed manic and wake up depressed due to the dysregulation of their neurotransmitters overnight, which are just those brain chemicals responsible for mood, among other things, like serotonin, norepinephrine, dopamine, those things. I recently did a video on the difference between the two, so head over to my TikTok account, Shrink Think with Dr. Jen, if you want more on that. Like most things, BPD runs on a continuum from benign to malignant. So people with a more benign form of BPD are more internalized. They tend to act out against themselves via self-mutilation, like I mentioned, more than others. They may withdraw or even isolate rather than lash out. On the other hand, people with malignant BPD are more externalized, so they're more likely to lash out at other people, destroy property, and they have more of an antisocial flair to their behavior. Antisocial meaning criminal, not asocial. So a middle point on the continuum might be someone with BPD who also has like a little bit of narcissism or maybe some entitlement woven into their presentation. I believe the number of people with BPD is actually underestimated because so many people are erroneously diagnosed with bipolar disorder. And then there are a lot of people who just suffer in silence. They're embarrassed, they're ashamed, they think there's something wrong with them. And there's not that outward behavior that's easier to diagnose. So you may be asking yourself how a person develops such negative thinking. Well, there are lots of theories about how BPD develops. It's that classic nature-nurture debate. So some say it's genetics and others say it's environment or upbringing. I say it's both. And there's usually trauma involved, most often sexual abuse. People with BPD don't process thoughts and emotions in typical ways. Due to their genetics and or their environment or upbringing, people with BPD experience thoughts and feelings as if through a microscope. They're exaggerated, they're highlighted, they're catastrophized, blown out of proportion. They're extreme and with great detail. They don't want to feel this way, okay, but they're unable to feel any different. It's almost automatic, like breathing. And anything said can be taken as throwing salt in a gaping wound, if you can imagine that. So those with the diagnosis essentially live in a great deal of fear. Fear of rejection, fear of abandonment, fear of failing, fear of succeeding, fear of living sometimes. Their emotional attunement and psychological development were halted at the time they were first traumatized, and they respond out of that painful place. In other words, historical issues sort of prime the pump for their reactivity, and then those present experiences trigger them and cause the pipes to burst. So the reactions of people with BPD may seem unprovoked, as I mentioned, but this is why many people get labeled with being a bitch or being seen as crazy. But what's actually happening in the minds of those with BPD is not dissimilar from what happens to those without the disorder, in that a thought triggers a feeling, and then the feeling results in behavior. Just like those without the diagnosis, people with BPD have these thoughts that come from subconscious self-limiting beliefs that generate conscious negative automatic thoughts. The difference is that people with BPD are more likely to respond or react impulsively by speaking before they think things through a little more fully. It's like there's a missing filter, if you will. So that lack of a filter is part of the reason I actually enjoy working with people with BPD, because they're often very honest and direct. There's never a question of where you stand with them. And my goal is always to help them create some semblance of a filter so their behavior can be regulated a bit and they can stay out of trouble in social and interpersonal settings while still being true to themselves and who they really are. So in treating BPD, I use a three-pronged approach. I use psychodynamic therapy to take patients through an in-depth exploration of family of origin and childhood experiences to help them understand these unconscious processes at work and then explain the diagnosis. And then I use dialectical behavior therapy to teach coping skills and help people change their information processing so they can see things differently and experience people and events in less volatile, self-loathing ways. It's just an information processing disorder, so we've got to do some reprogramming. And then third, I use cognitive behavioral therapy to help people improve their self-esteem by exploring the negative automatic thoughts and self-limiting beliefs that keep them stuck in old patterns of behavior and help them replace those with more adaptive ways of thinking. So if you have BPD, the bad news is that you've been doing things your own self-destructive way for a long time by the time you're watching this video. The good news is that there's hope and help with the right kind of treatment. People with BPD are like wild mustangs in that no one has helped them to not be afraid. No one has taught them there's another way to behave so that life isn't so traumatic or dramatic for them on the daily. I have found that people with BPD are often really relieved to learn that there's another way to live and maintain relationships. And truth be told, they're generally exhausted by all of the emotional intensity and upheaval, and they really look forward to doing things differently and living a fuller yet less dramatic life. So once there's a basic confidence established, a person with BPD can go out and practice the new ways of living, starting with small efforts. After that, a positive feedback loop is established in that success breeds confidence, breeds success. So if you have BPD, I want you to know that there's hope. Do not give up. It's my specialty, and my colleagues and I can help you. If you want to schedule an evaluation with me, just check out the process in the comments. And if you have BPD and are in a relationship, or you're in a relationship with someone who has BPD, and you want help navigating your relationship challenges, you can check out my new book for help with this. Simply search Fix Your Freaking Marriage on Amazon and check out those later chapters about dealing with difficult personalities. Thanks for watching. See you next time.